Our next guest says the government intruding into our end-of-life decisions is just the tip of the iceberg in this unconstitutional law. Here now is former Lieutenant Governor of the state of New York, Dr. Betsy McCaughey. Betsy, welcome here.
Thank you.
So the government couldn't accomplish this by an actual vote. I mean, they mocked Sarah Palin, Governor Palin, when she said there are death panels in this law. And then eventually people wrote to members of Congress that were Democrats saying, if it's in there, get it out. And it was in there, and they got it out, and the bill became law without the death panels. Suddenly they crop up over Christmas weekend. How did this happen?
Unfortunately, the Obama administration is attempting to achieve by regulation what the public refused to allow them to legislate. And these end-of-life counseling sessions appear to be less voluntary than the administration would say, and the government appears to be trying to script what is actually said in these counseling sessions rather than letting your doctor decide.
All right. Now, as I understand it, correct me if I'm wrong, the law as it now stands will compensate these doctors, pay them money when they have these end-of-life conversations. And the more conversations they have, the more they will be paid.
That is not the problem. The problem is twofold. First of all, in the Obama health law itself, which is right here.
By the way, is that the law in front of you? Every time I see you, you've got this monumental loose leaf under your arm.
Well, and Section 936 says that the government is going to create decision aids, in other words, brochures and leaflets and other materials to hand out to Medicare patients on how and when to die. This is not the government's business. Uncle Sam shouldn't be providing this advice.
If the government is paying for people's health care and they are at the end of their life, does the government have an interest in talking them into dying?
Absolutely.
So that the government will have less to pay for?
Yes. Uncle Sam is not an impartial advisor any more than Aetna or Cigna would be, because the less health care you get, the less the government has to pay out. And, of course, this Obama health law expands Medicaid by eviscerating Medicare. It literally reduces future funding for Medicare by some $500 billion over the next decade, when 30% more seniors are going to be enrolled in Medicare.
All right, now correct
me. So that's what makes this particularly problematic.
Correct me if I'm wrong. The government will know what the doctor says to the patient and what the patient says to the doctor, because among the monstrosities underneath your left hand is the destruction of the patient-physician privilege, when federal bureaucrats will know what the doctor says to the patient and the patient says to the doctor.
Yes,
right?
But here's the other problem. Medicare pays doctors a bonus based in part on how many of their patients they convince to make advance directives or living wills. And beginning in 2015, Medicare will actually penalize doctors based in part on how few of their patients do this.
Let me get this straight. Is the government going to pay doctors to talk people into dying?
Well, pay them for talking people into making these advance directives, which generally mean accepting less care toward the end of life. And here's the problem. Medicare already pays doctors so little that some doctors are going to be tempted to put a lot of pressure on their patients. And when somebody in a white coat says, sit down and listen, it's hard to say no, and that's why it's not strictly voluntary.
You're the former Lieutenant Governor of the state of New York. You're also a scholar. You have a Ph.D. in American constitutional history. Isn't the first job of the government to preserve our freedom and to preserve our lives? Isn't this, if that's so, isn't this law doing the opposite?
It's doing the opposite, and the problem is also that this end-of-life counseling is supposed to be part of an annual visit to the doctor.
Wow.
That's like a drumbeat for early death. And frankly, those visits are so short that doctors are going to have to skip over talking about proper diet or exercise, things that could actually extend your life
Betsy
instead
McCaughey,
of cutting it short.
Thank you very much for joining us. Forget death.